So this leads to my next question is how do we think about the types of support that are possible for people who are in this space of living with advanced cancer? And I want to just take a moment to talk about what palliative care is, since this is my area of focus. So palliative care is a specialized type of medical care that's for people living with a serious illness, and it's appropriate at any age and any stage of illness. And it's focused on providing relief from symptoms and stress of the illness, and the goal is to improve quality of life for both the patient and family. And on the right of this slide in the blue circle are some of the things that we in palliative care focus on: symptom management, psychosocial support, supporting people's understanding of their illness and making decisions, and then thinking about the future and kind of their preferences about their care, thinking about the spiritual and cultural aspects of care, and supporting people in any decisions they might need to make. Next slide, please. One thing I really want to emphasize, though, that may be a perception that people have, is that palliative care is not end-of-life care, or I should say it's not exclusively end-of-life care. Palliative care originally kind of grew up as symptom-focused care for people who are close to the end of life, and has expanded in recent years to be a focus on quality of life that's appropriate at any stage, at any age, kind of throughout the process of dealing with illness. This kind of shows the outdated idea of, you could focus on quantity of time and focus on fighting the cancer, and then at a certain point you totally shift gears to focusing on quality of life. And so that kind of quality versus quantity question kind of was the old idea, but the new idea about thinking about quality of life focused care is thinking about layering a focus of quality of life on top of the things that we do for disease modifying care, to extend length of life. And so thinking about quality and quantity. And I include in this that, the palliative care is shown here in this light blue, and kind of showing that it wiggles. Like sometimes you need a little bit more palliative care, sometimes you can focus less on palliative care. And that as people's health changes, the amount of palliative care that somebody needs might increase. And it's included in here that hospice care is a part of palliative care, because it's true, part of my training as a palliative care doctor is in hospice care, and that's when quality of life focused care is the main and exclusive focus of care, when there aren't any options for using cancer-directed care. And, I'm trying out a new analogy, so you'll have to let me know how this works, but I was thinking about this in terms of, saying that palliative care and hospice care are not synonyms. They're only synonyms so much as the whole alphabet and the letter Z are synonyms. So the letter Z is part of the alphabet, but it's the very end. There's all those letters A through Y that are important. And so I think about palliative care being appropriate for so many more people than who are currently accessing it right now. Next slide, please. And the way that we know this, the way that we know that palliative care can be helpful for people throughout the course of dealing with advanced cancer, is from some studies that really gave us excellent evidence to demonstrate that early integration of palliative care helps people. There was a randomized control trial here at Mass General, conducted by Jennifer Temmel and colleagues in the clinic where I practice, that showed that integrating a focus on palliative care, on quality of life from the time of diagnosis, helped people with improved quality of life. It helped them with improving their mood and their understanding of what to expect from their illness. It decreased the use of non-beneficial treatments, like being in the ICU at the very last moments or dying in the hospital. And what was a surprise to everyone, like I've mentioned before, we used to have this kind of binary idea of quality versus quantity. So they looked at kind of how the effect was on quantity of life to make sure that it didn't shorten people's lives to focus on quality. And people actually lived longer when they were receiving kind of quality of life focused care. That wasn't the purpose of the study. The purpose of the study was to look at quality of life, but this definitely raised eyebrows and helped launch a lot of palliative care programs, just to show that this helps people and doesn't take away from the cancer-directed treatment to focus on quality of life.